Okay, this is my second follow-up video to the forehead lowering surgery. I couldn't believe when I looked at the views of this video how many views both of them have gotten in like a short period of time without promoting them or anything. You know, it's not like I've been putting them uh, on social media or anything like that. Obviously, like it's kind of a private matter. I don't sit there announcing to everybody in the world like I got forehead lowering surgery. Like, you know, it's kind of drastic. Um, I mean, it's not that drastic, but who am I kidding? It's a very drastic thing to do to your face. I mean, you're literally changing the proportions of your face. So yeah, I wanted to make another video and update because I think a lot of people who don't normally do surgery, it's so weird that I'm saying that I normally do surgery, but I've done several surgeries. And what I know is that you kind of really have to let it set until you start to really like the results. And I liked it sort of like at first. I mean, I did love my little forehead, but there was like swelling, there was weirdness, there was so much itching at the time. My hairline was kind of awkward. I didn't really know how to style it. It looked really weird because the bangs were used to growing a different way. And then my colic was still kind of, so I had like some awkward issues acclimating and playing with my hairline, and then just straight up that the hair wasn't growing there in the place that the incision was, and then also with the scar itself, um, which wasn't that horrendous. I mean, unless I told people, they wouldn't know, so it wasn't bad. But now it's going away, and I'm not using concealer. I wasn't really before because it like gets mixed up with the hair, and then it's just a mess. So a girl had voiced, or a person had said in my comment section on the last one, that they wanted to see the hairline itself and where the hair is growing in, because I think I had bangs in the last video. So I want to show you what it looks like. Now, because I'm terrible with technology, like I'm horrible. I don't know how to splice videos. I'm literally like, I'm one of those people that needs to go to adult school. Um, I don't have like a before and after photo, but you can look at some of my older videos and you can look at the way that my forehead looked then versus how it looks now. So here's my hairline right here. And I don't know if you can see the little baby hairs. You kind of can. Now, granted, I kind of ripped out my hair with bleach because I didn't realize I was doing my own bleach. Before COVID, I wasn't fully bleaching I wasn't doing my own hair really. And then when COVID started, I was just doing my own hair, and I didn't realize that when you use on the scalp bleach, you have to use a barrier beforehand. Even though I am a licensed hairstylist, I don't work as a hairstylist, and like it's not like I was sitting there putting off the scalp bleach on people's heads. You know, that's not what I was doing as a hairstylist, so I didn't really know. Then when I put coconut oil on beforehand and then I put the bleach over it, like that fixed that problem, but that's still a separate problem. Anyway, like it was like ripping out my hair in itself. So you might not have, what I'm saying is another person who gets this surgery will have hair growing back faster than I do. So here's the sides. It looks like a really natural looking forehead. That's what I like about it. Like it doesn't look perfect, you know, and that's what I like. It's kind of zigzaggy. And I think that's like the mark of like a really good job. Another person had said that they wanted to do the surgery themselves, but they not to themselves, but they wanted to do the surgery, but they were nervous about the scarring. I think, and I don't know this for a fact, that scarring looks different in different parts of your face. For example, when I got my lower face lift and then my lower face and neck lift, there is a lot of scarring behind my ear. But I'm a younger person. That tends to be very normal with younger people. It has nothing to do with technique. It just is what it is. Actually, like my surgeon has fixed the scarring since then. But there were significant scars with this. They're not significant. They're not. And you would probably look at my face and yeah, that face scars because I have fair skin. And I have pretty thin skin, but I think it just has to do with the forehead. Now, there was another person that had done this, and they were really upset about their own scarring, and then they had it redone and then had the implants done in conjunction with the hairline surgery itself to camouflage the scars. And I think that she had had scar correction surgery done as a second surgery too. This is this is a girl I watch on YouTube. I don't know her personally. That's just what one of her videos was about. So I can't speak for anybody but myself. I didn't really scar. I mean, I've gotten several things done on my face, and the scars are, you can't really see them. You could kind of see this when I did my upper eyelids, like it looked like a dermal. Actually, I think this from the lower eyelids because he went in like that. And that looks like a scar at first, but I think the results were so nice and my eyes looked so substantially much more open and better than they did before the surgery that it was worth it. I didn't really care because I could put eye makeup on to cover it up, and now I love the results. So I guess my number one advice as far as picking a surgeon is to, no matter what, even if you're like 100% sure that you want to go to like a specific person, just go to a few people just for your own peace of mind. When I had gotten my first nose job in like 2004, was it 2013? Yeah. I just took my friend's word for it. She worked at the office, and this guy butchered. He did a terrible job on my nose. I hated it. I was so sad. I was so depressed. It looked worse than the nose before, and he didn't even take an after photo of it. So he knew that he didn't do a good job either, and he was totally rude and totally snotty to me afterwards. And my current doctor actually fixed my nose, and he just did tip-plasty. And like, people ask, like, they know, people who know me know that I did it because they could tell the difference, and so they're like, where did you go? Like, I really think you did a good job. He did a good job, so hopefully that ends up being a good thing for their business. But yeah, so yeah, I would say interview people, ask them questions like, how long have you been in practice? Make sure that they're board certified as the American ASPS plastic surgery. Make sure that you, whatever procedure you want, go onto the American Society for Plastic Surgery definition of that particular surgery and make sure that you read it in whole so you understand exactly what it involves. Because usually with each procedure, there are several parts and several different ways that the doctor can do it. And make sure that you know exactly the difference between the different ways. Like, for example, like if you were going to do rhinoplasty, is it going to be closed or open? If you're going to do a brow lift, are you going to do an endoscopic brow lift or are you not? Do you know the difference between an endoscopic brow lift and just like a conventional brow lift? If you're going to get forehead lowering surgery, is there going to be a brow lift as a part of that? And how much will the brow actually be lifted? Like, just make sure that you're as specific as possible, because I think the more specific you are, the more likely that you and your doctor will have an understanding. And if the doctor starts getting frustrated with your questions at first and they start to kind of skim over and give you vague answers, and you're somebody who doesn't like that, then you're not going to like that doctor. So it's time to go to somebody else. So yeah, I trust my doctor, so I'm not, I was so scared when I took the bandages off because I was like, oh my God, my forehead looks tiny now, because it's only from here to here, and like all in here was just blood, because they literally spray your head down with alcohol and it's a bloody incision. And then, because they have to sanitize it totally, and so there's blood stuck to every part underneath the bandage, so all you can see is this part. And I had to wash my hair like 3 times, or 4, actually probably 3 times before I could see it, and it took about 7 times before the blood was out of the hair. Yeah, so those are all things that you know, and you just want to make sure that you understand and that you've talked about with your doctor. And also going to the American Society of Plastic Surgery definition of each surgery and really saying, is this going to happen? Is that going to happen? Like, is this going to happen? Like, make sure that you're getting exactly what you want. Like, if you think, if, for example, if you're going to get a neck lift and you want you want them to tighten the muscles and you want them to lift the skin, sometimes they'll treat that as two different surgeries, but sometimes they'll treat it as one. You know what I mean? So you just have to make sure that all the specificity is involved when all of it is there and the ground rules are laid and there's an agreement between the both of you of exactly what's going to happen. What else? I don't know. The online thing is really hard. I used to rely a lot on online reviews, and then there was like a bad situation that happened with like a realtor, and I'm like, wow, this realtor is like really shady. But then there were no bad reviews, but then a personal friend of mine was like, oh yeah, no. So, I mean, I don't know. I mean, reviews can be doctored and they can pay Yelp to take the reviews off. So I would really just go in there yourself, because some doctor offices won't pay to take the bad reviews off. And also with reviews, I try not to look at emotional responses, like when they were like big, like they capitalize words or they get really, really flowery with their, they start doing like a war and peace about their experience. I'm like, ooh, this person's really emotional and their review is probably very biased. Not to say that all reviews aren't biased, but that's one thing. And then after your procedure, just make sure that you take pictures. And I'm telling people to take pictures, but like I don't really take pictures of the before and after myself. Your surgeon will do that too. And just make sure that you follow up. But like I was happy at first, but I was like, ooh, I don't know if I should have done this. This is so drastic. Like my hairline is being weird. I have a hard time brushing my hair. I feel like it looks different on my face. My face looks so much different. It's hard for me to get used to it. But then like a few months later, like right now, like the last week or so, I just went, like it's been looking better every day. So I'm like, yay, I'm so happy that I did this. I couldn't be happier. And I'm not trying to like normalize plastic surgery. And who say that you'll be happier in your life if you get it, because trust me, like it doesn't do that. But it does make you less self-conscious. Like I noticed that I wasn't always cutting off my forehead in my selfies, but there were a couple times that I was. And then actually, a friend of mine was saying, oh yeah, girls do it all the time. They cut off like half their forehead in their selfies, or they wear these like straight across bangs all the time. So I didn't realize how many people are like really self-conscious about their foreheads. But I kind of blame social media for that too, because they give you these like standards that nobody can meet, and most people on social media don't even look like the people on social media that they are. And like I think I'm really hard on myself because of the pictures that I see on social media too. I'm definitely influenced by that. So the itching, I know I'm getting sidetracked a lot, but the itching is, it's happening, still, but a lot less. Like it used to be all the time for a while. I was like, oh God, it's so itchy. And this is like embarrassing, cause I'd be like with my boyfriend and I'm like, So now that's going away. It's weird when you start to gain like the whole feeling and you're not itchy anymore, but it's like your scalp is sore from scratching it so much because you get feeling in your scalp. That's like a strange transition. But I was like, oh, phew, I'm so happy. Like, I'm happy I'm getting feeling there. Because you'll get an incision here, but you'll still get the itching in these areas. And I was reading that even with people who just get brow lifts, they have that for up to 6 months. To even a year, like they'll have those like itching feelings. So I think that's about it. I hope everybody had questions answered and that this video was informative, not just for brow lift or forehead lowering, but also for to apply and make applicable to other procedures, or just looking for a surgeon in general to do your work. And that's about it. Thanks.